This book is a memoir, really, of my 35 years of practice, including how I got here in the first place, because I'm a Midwestern guy who came to Beverly Hills after being trained in plastic surgery, never expecting my life to turn out this way. And so it's about that, and it's about my experiences with this media-conscious, celebrity-driven, youth-driven culture in Beverly Hills, which I wasn't entirely prepared for when I came out here, but which I'm enjoying very much. I don't know, I was just having so much thinking one day, starting about 10 years ago, about all the interesting patients I've dealt with over the years, and I just started writing down some of the anecdotes, most of them pretty funny, but then a few of them got pretty serious, and then one day I decided, you know, I got all these things here, let me put it in a book, and it's worked out very nicely. I hope anybody who reads this book will get a little more understanding of the needs of reality testing. In other words, they need to know what they can really accomplish with it and whether it's appropriate or not. It's very easy to find a plastic surgeon who'll do almost anything you want, particularly in this community, but finding someone who is on the right level with you and who understands what you'd like and who can deliver what he promises is very, very important. Also, I think they're going to laugh and have a good time with it. It's kind of funny. One of the important things I stress in this book is that people you see on the movies, screen, and television have had a lot of work done. Now, they may not have had plastic surgery, although honestly most of them have had something done, if only a little bit of fillers or Botox. But these people who get these jobs basically are pretty to start with. In fact, usually their parents are pretty to start with. So that's why they came to LA in the first place, looking for a job in the entertainment world. But then once they get here, and once they get a job in it, the beautifying industry jumps right in there and helps right along and does hair treatments, makeup treatments, dental work, lighting, which is a genius art form, cinematography. But truly the real essence of a great performer is true talent, and that comes from within. But people should know that if they don't look like their favorite screen idol, these people don't look like their favorite screen idol when they don't have their makeup on either. And trying to reach that degree of perfection is chasing the end of the rainbow. And if a patient comes to me and says they want to look like a certain celebrity, I usually tell them I don't do that work, and I would caution them against trying that. Many of these celebrities they want to look like really don't look like themselves anymore. I once did a patient a long time ago, attractive woman who I did a facelift on her, turned out very nicely, but then afterwards she was very unhappy. In fact, she tried to sue me because she said she no longer looked like Elizabeth Taylor. The fact that Elizabeth Taylor no longer looked like Elizabeth Taylor wasn't fazing her, but of course she could never find a reasonable attorney who would represent her because it was crazy. So for the most part, I discourage people from trying to look like a celebrity. Now, if they say they admire the way a certain celebrity face looks, or their nose looks, or their eyes look, I can take that into the mix and work with them on it. But to say they want to look like a celebrity, usually to me that's a tip-off that this is not a reliable patient or a reasonable patient. The most bizarre plastic surgery I've ever performed was when I did a nose job on a snowman on the Jay Leno show. I got a call from Jay Leno's producer, this was years ago, saying that Jay was doing a Winter Wonderland thing, and they wanted a real plastic surgeon to come in and do a nose job on a snowman. And I said, I don't really know that this is what I can do. And then she said, well, you don't have to do it, but if you don't do it, we'll get so-and-so to do it, another plastic surgeon who I knew very well. And I said, hey, when do you want me there? Should I wear my white coat? What do you want me to bring? And they said, I'll just bring your white coat, and would you do a liposuction on him too? I said, sure, no problem. It was very funny, and I had a lot of fun doing it. I've never had a request from a patient for lopping off a carrot on the nose before, like on a snowman. Patients, I think, really want, when they come to the plastic surgeon, they want to feel better about themselves. Most patients who come to me do not want to look like someone else, or do not want to look like they've had plastic surgery, certainly, but they just want to look better, and then which comes to make them feel better about themselves as well. And that, in my mind, is what we really do. Sure, we may improve an appearance a bit, but the real change in the person comes from making them more confident, and that's what comes out to the outside world. That's what makes them so much more attractive afterwards. The photo on the cover of the book, and the answer is yes and no. And you'll have to figure that out for yourself.